Ashley. Well, thousands of Americans are diagnosed every year with thyroid conditions. But what exactly does that mean, and when is it time to see an endocrine surgeon? Here to talk about this is Dr. Glenda Callender, an endocrine surgeon and medical director of endocrine surgery at St. Vincent's Medical Center. Doctor, welcome.
Thank you so much. Thanks for having me.
Thanks for being here. So what are some of the conditions that bring patients to an endocrine surgeon like yourself?
Well, an endocrine surgeon typically does thyroid, parathyroid, and adrenal surgery. And so some of the conditions that an endocrine surgeon treats would be thyroid nodules, thyroid cancer, parathyroid diseases, including all types of hyperparathyroidism, and also adrenal nodules and adrenal cancers.
All right, what is the difference between thyroid and parathyroid glands?
It's a great question. Everybody asks me this. So the thyroid is a butterfly-shaped organ that's located in the front of the neck. It's very important to your body because it makes thyroid hormone, and that controls your body's metabolism. It's very common actually to develop thyroid nodules or even cancers within the thyroid. The parathyroid glands, on the other hand, are tiny little glands. There's usually 4 of them. They're located behind the thyroid, and they're very important to our bodies because they control the level of calcium in the bloodstream. And if you develop a parathyroid disorder, that can cause your blood level of calcium to be too high, and it can cause a lot of problems with bone and kidney disorders.
All right, talk about how that cancer is treated.
Well, thyroid cancer has a lot of different kinds of treatments. So it depends on the type of thyroid cancer, how big it is, whether it has spread to lymph nodes or other parts of the body at the time of diagnosis. Some patients who have really small thyroid cancers can actually just be monitored, but most patients with thyroid cancer will need to undergo surgery. Surgery could mean removing part or all of the thyroid. It could also mean removing some lymph nodes. After surgery, if there's concern that thyroid cancer has spread anywhere else in the body, the patient might need a treatment called radioactive iodine. But we typically don't use chemotherapy or radiation treatment for most types of thyroid cancer.
Interesting. All right, what about the long-term outcomes of thyroid cancer? Can it come back?
Yeah, so the good news is that the prognosis for most patients with thyroid cancer is absolutely excellent. With the proper treatment, most patients can expect to live a completely normal length of life. The most that patients have to deal with thyroid cancer usually is that if their thyroid was removed during surgery, then they would need to take a thyroid hormone pill afterward, but that's usually very manageable. Thyroid cancer can recur. And if it does recur, it's usually still very treatable, either with more surgery or with another dose of radioactive iodine. But patients can expect, in most cases, to be treated and then still live a very long, full life.
All right, Dr. Glenda Callender, thank you so much for joining us.
Thank you for having me.
Thank you.